we have identified 1,549 new cases of COVID-19 in Alberta in the last 24 hours. We completed about 19,500 tests yesterday, and our provincial positivity rate sits at about 8%. There are currently active alerts or outbreaks in 304 schools, about 13% of the schools in Alberta. This number includes 64 schools that are currently on the watch list. There are now 328 people in hospital with COVID-19, including 62 in ICU. Sadly, I must also report 5 new deaths from COVID-19 in Alberta. My thoughts go out to everyone who has lost a loved one to any cause during this pandemic. I know that many families and friends continue to grieve those who they've lost. I have now reported 476 deaths from COVID-19, which is both a reminder of this virus's deadly potential and further proof that we must take steps to reduce community transmission. It's clear that we have reached a precarious point in Alberta. The virus is spreading faster and more widely than at any other point during the pandemic. Last Monday, we announced 860 new cases. On Sunday, less than a week later, we announced 1,584. The number of fatalities from this virus is growing, and the number of hospitalizations and ICU admissions continues to rise, challenging the health system's ability to deliver the care that Albertans need in the future. This is impacting the care not only for those suffering but from COVID-19, but from a wide range of other health needs. To put it as plainly as possible, this is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures to stop. We must take action. Waiting any longer will impact our ability to care for Albertans in the weeks and months ahead. As Chief Medical Officer of Health, my role is to provide advice to government on how to protect the health of Albertans. Today, I will meet with the Priorities Implementation Committee of Cabinet to discuss a series of new measures to reduce the rising spread of COVID-19. Based on their decisions, we will provide a detailed update to Albertans tomorrow. I will also hold media availabilities every day this week to provide the latest information available and to answer whatever questions I can. We will provide more information tomorrow once decisions are made, but I wanted to provide this information today and to provide a message for everyone in our province. I need your help, and we all need to work together. The spread of the virus, the impact on our health system, and the challenges it poses to our health are serious. We all need to reduce our social and cohort interactions as much as possible. If you can adapt your life to reduce the amount of time that you spend interacting with others, please do so now. I think that over the course of the last several months, particularly over the summer, late summer, early fall, I think there were many people who hoped that we had seen the worst of the pandemic. Of course, what we know now and what we can see not just in Alberta but around the world is that this virus spreads much more rapidly in the fall and winter than it does in the spring and summer. And we can see that the interventions that were successful earlier this year are not as successful at the moment because our circumstances have changed. So we really do need everyone to pull together. And I am grateful for the support of those who are reinforcing that message and making sure that that message is getting out there. This is a challenging moment, but our province is strong and there is hope. We are seeing extremely promising news around vaccines and treatments, which may start being available sometime in the new year. There is light at the end of the tunnel, but we cannot let up now. Every one of us must do our part to limit the spread of COVID-19. We are in this together, and we are strongest together.